بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. اللهم أخرجنا من ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم. اللهم ارزقني نعمة الإخلاص لوجهك الكريم بكل ما أقول وبكل ما أفعل. My topic today is about continuing with the basic course of upper abdomen anatomy, and here in this short talk I will discuss the spleen. As we see here, this is the spleen. Next slide, this is the spleen, and this is the spleen, and this is the spleen here, and here this is the spleen, and here we see the tail of the pancreas and the hilum of the spleen, and this is the spleen here, and this is the tail of the pancreas also. Here this is the tip of the spleen, and here this is the tip of the spleen, and there is no spleen here. And here we see the spleen, as the spleen is located in the left upper quadrant, and it is upper ball related to the lower ribs. This is the upper ball, it is related to the ribs, and the inferior ball, as we see here, it is extend to the level of L2. To the level of L2. The tip of the spleen is usually palpable only in pathologic condition. Normally we cannot palpate the spleen, and some of the pathologic condition we can palpate the spleen if it is enlarged, like in thalassemia, leukemia, infection, lymphoma, etc. The spleen, it is held in place by gastrosplenic and splenorenal ligament. It is held in its place by gastrosplenic and splenorenal ligament, and the tail of the pancreas is also found in the splenorenal ligament in the hilum of the spleen. As we see here, this is the tail of the pancreas, and here this is the tail of the pancreas and the splenorenal hilum. The blood supply to the spleen, it is through the splenic artery, and this is one of the branches of the celiac trunk. The splenic vein receive its blood supply, as we see here. This is the splenic vein. It is receive its blood supply from the inferior mesenteric vein, and they form the portal vein. This is the splenic vein, and this is the superior mesenteric vein, and this is the portal vein. So the spleen is splenic vein receive inferior mesenteric vein to form the superior mesenteric vein, as we see here, and it will continue as the portal vein to form the portal vein. The spleen is highly vascular organ, and this is source of bleeding. in trauma patient. And also the spleen is contain reticular endothelial system cells, and these are involved in producing the antibodies uh, for to invade the foreign invaders. Let us see some anatomic slices. Here we see the spleen, and here we see the splenic artery, and here we see the pancreas, and here we see the descending colon, and this is the splenic hilum, and here we see the left adrenal gland. Here we see also the spleen, descending colon, and this is the transverse colon and left adrenal gland, and here this is the pancreas. Again, descending colon or splenic flexure here, and the spleen and the splenic vessels, left adrenal gland, and the pancreas, aorta, IVC, and the right adrenal gland, and this is the portal vein. The portal vein, it is consists of formation of the splenic vein with the inferior mesenteric vein and joined to the superior mesenteric vein to form the portal vein. As we see here, this is the splenic vein. Sorry, this is the superior mesenteric vein, and this is the superior mesenteric artery. And here, this is the splenic vein with the superior mesenteric vein from the portal vein. And here, this is the tail of the pancreas and the splenic hilum in the splenorenal area. And here also the tail of the pancreas, and this is the tip of the spleen, and this is the left kidney, aorta, right across of the diaphragm, left across of the diaphragm, and this is the descending colon. And again, this is the splenic vein, and this is the this is the superior mesenteric vein, superior mesenteric artery, and this is the portal vein, and this is the pancreatic head. And here, this is the left renal vein, and this is the descending colon, and this is the spleen, the tip of the spleen. As we said, the tip of the spleen, it is at the level of the L2. And here, this is the transverse colon, and this is the ascending colon and hepatic fracture, and this is the liver. Thank you for listening and hoping to see you soon in another talk. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك.